Hi, welcome to another edition of Mindscape Matters, a channel to discuss mental health and related issues. I am Mohan, I am a consultant psychiatrist in Chennai, and I'll be your guide as we tour this wonderful mindscape. Have you ever wished that you had a pain-free life? Think about it and remember your answer. Now, if your wish was to have a pain-free life, I'll tell you something to ponder. There are many people with diabetes who have a complication of diabetes called diabetic neuropathy. It just means the diabetes affects their peripheral nerves, and as a result, they lose the sense of touch and pain in their extremities, both the hands, extremities, and typically we call it a glove and stocking kind of. Wherever the glove is, they won't have sensation, and wherever the socks is. What happens because of that? Now imagine we are walking somewhere. Suddenly we feel a pain in the leg, and in a reflex action we take away the leg. We don't think there is pain. Let us examine what is the cause of the pain. Let us analyze, and if there is a nail, then we should take away our leg from the nail. No, we don't think. We have the pain, and immediately as a reflex, even before we realize, our leg is out of the danger. Whereas a person with diabetes who has this loss of pain, if they step on a nail, they will not feel the pain, and as a result, they continue to walk while the nail is stuck to their leg. And as they keep walking, the nail pokes inside more and more and make it infected at some point of time. And only if they look at their wound, they know that there is a nail there. Otherwise, because of lack of pain, they will not realize. Similarly, there are a lot of diseases where somebody's sense of pain can be lost. I'm not going to list quite a lot of them. Commonest is diabetes and leprosy. There are a whole lot of other illnesses. Say, suppose somebody is cooking. Unless they are looking at their hands while they are cooking, they will not realize that their hands have touched the hot pan. Now, when we are cooking, when our hands touch, we just immediately take even before we realize what caused the pain. Whereas for them, they need to look at the hands, or many of them sadly will realize the hands have touched the pan only when they smell burned flesh. Only then they realize that by then the hands are burned a little too much. So here, pain has a major function, that is protecting you. Pain protects you from a major danger, a major injury. Another aspect of pain, we had referred to it in an earlier video called DOMS, or Delayed Onset Muscle Soreness. I'll explain to you again. Suppose you start exercising after a long gap, or if you're scaling up on your exercise. What happens is when your muscles are made to act more than what they are usually used to, there will be small inflammation happening, a micro kind of inflammation happening in the muscle. When I say inflammation, the muscle fibers can rupture, and that causes soreness. Now, the muscle fibers which have ruptured heal together, and when they heal, they become bigger. We call it as hypertrophy, and it also signifies the muscles are becoming bigger and stronger, and that's the process. So this DOMS can be a repeated affair. So here, what is pain telling us? Pain is telling us that your muscles are becoming stronger and stronger. Third aspect of pain, somebody has severe abdominal pain, can't tolerate. They rush to the hospital. The duty doctor sees them, calls the surgeon immediately. Surgeon comes, examines and diagnoses appendicitis and investigates to substantiate. Ultrasound shows appendicitis, and they do a surgery and they find appendix is infected, and it's like it would have burst if not acted immediately. So what has pain done here is, pain acts as a signal to tell you that there is an underlying problem which needs to be addressed. So here, pain is a signal. Now, many of us might have mild toothache, and we normally postpone. We see, let's see. And by the time it's very severe, it's 11 o'clock in the night and we call our dentist and say, please, can I come now? And they will say, no, I'm not here. I will see you tomorrow morning. Today you take this medicine. So here, unless you attend to the mild pain, it's going to become severe. So both mild and severe pain are signals that there could be an underlying illness. You need to sort it out. Not just physical pain. The same thing applies to emotional pain, sadness, anxiety, anything which causes emotional pain. Emotional pain can be a protective mechanism, telling you that this place is not a good place, this situation is not a good place, should I limit it, should I leave? So that way emotional pain can act as a protective mechanism. Second, emotional pain can be a signal to a much larger problem that needs immediate attention. Third is, enduring emotional pain can tell you that you are becoming stronger. You must have heard this quote, what doesn't kill you makes you stronger. So emotional pain also has its positive points. If you are friendly with pain, what I mean by that is, if you can coexist and be comfortable with pain, you will understand what your body is trying to tell you. Now, I'm a cyclist and we tell riders, listen to your body. I'm sure all the sportsmen say that. What we mean by that is, suppose you are on a ride and you slowly feel a muscle pain. Sometimes changing the gears will make the pain go away. Or sometimes it can persist and it could be a sign of an impending cramp. Now, most cyclists know how to prevent cramps by taking appropriate fluids. But if there is a cramp, you will get an early warning by pain. Now, and you take a remedial action. Suppose the pain is not in the muscle, but in a joint, like knee joint. And whatever you do in terms of changing your speed, changing your posture, changing your gear, the pain persists. We usually tell the rider, stop riding because the pain is telling you are hurting the joint. Now, some people will say, oh, I had a pain, severe pain when I was in 350 kilometers. It's only 50 kilometers more, so I rode with pain and finished. No, we tell people a 400 kilometers ride will come again next month. What is more important is your long-term health. Take rest, come back next month and do it again, rather than punishing your knee and being out of action for the next 3 months. So if you are friendly with pain, you will be able to differentiate, is the pain a protective mechanism? Is it a signal about an underlying problem? Or is it telling you your muscles are becoming stronger? Or a fourth category, are you indulging in self-harm? Are you inflicting pain by doing something, overdoing something? Do you remember the question I asked in the beginning? Have you ever wished for a pain-free life? I'm asking you again, do you want to review that decision? Do you want a pain-free life? Think. Thank you for watching this video. If you found it useful, please tell 2 of your friends. If your friend or relative would want to watch this video in Tamil, there is a Tamil channel with the same content. And if you want further updates from the channel, please subscribe. Till we meet again, Mindscape Matters.